The CDC finds that only about 65% of women between the ages of 50 and 74 with 3 or more health-related social needs are not up to date with their mammograms. According to that study, some of the reasons why they are less likely to get one are health costs, loneliness, not working as much as they used to, and not having reliable transportation. So joining me live in studio is Roswell Park Chair of Diagnostic and Interventional Radiology, Dr. Ermelinda Bonaccio. She specializes in breast imaging. Thank you for being here this afternoon on Most Buffalo. So we want to break down what's going on here. The study also says if you don't have health insurance or if you don't have a regular doctor and you usually don't go to the doctor, you're also less likely to get a mammogram. So what's being done here in Western New York to encourage people, especially people experiencing some of these things, to go and get their yearly mammogram?
So this study provides data for what we already know and what we've been working very hard at Roswell to overcome. We have 2 outreach groups that we work very closely with. One is the National Witness Project, which works with predominantly African American community, and one is in the Esperanza Ibedo, which works in the predominantly Hispanic community. And basically what you have to try to do is overcome these barriers. Some of it is education, realizing that even if you're underinsured or not insured, cancer services programs will cover screening mammograms. Some of it is actually helping with the practical, providing transportation, child care, hours that are convenient so that women don't have to take time off. Right. So early hours, late hours. Tomorrow, actually, we're having a Saturday screening event. We try to do it at least once a month. So it's about addressing these barriers. We are actually now hoping, it's supposed to pass the state budget, and Governor Hochul is supportive of it, a grant to start a mobile mammography unit. So literally we can take the mammography to the neighborhoods.
And the women who need the mammograms.
Correct.
Once you go once, you kind of know what to expect. And it gets easier. At least for me, it got easier because I didn't have that anxiety, never having done it before, and just seeing video of women getting mammograms. So what advice do you have for people who are nervous about going the first time?
Well, I think a lot of what we're nervous about, one is, yes, women are nervous about the pain or discomfort. Which I think discomfort is a better word for it. For most women, it's just uncomfortable. Right. And it's not painful. But what we're worried about is the results. I mean, at the end of the day, we're looking for cancer. So what to keep in mind is that 40,000 women die of breast cancer a year. Mammography lowers the rate of mortality from breast cancer by 40%, along with the better treatments we have. And most mammograms are actually normal, but if we find something small, we have so many better options to treat, less aggressive options because it's smaller, and more likely to survive the cancer. So that's what we try to communicate to women, educate women about having that yearly mammogram. It's so important. It's
super important. Even, I went and got a baseline, then when I turned 40 and go every year, and it's just so easy now. And it's like, why wouldn't you go? But if you haven't gotten it done before, it can be scary and nerve-wracking.
Yeah, and if you have, and the point of the study, if you have these adverse social determinants of health, it creates additional barriers other than what is already a little bit of, a stressful exam. And you have all these other barriers. And what we really try to do is work with the community to remove those barriers.
All right. Well, thank you so much for sharing part of your afternoon with us here today.
It was my pleasure.
Good tips. And if you want to know more information, give us the website.
Okay. It's roswellpark.org, and 1-800-ROSWELL is the number to call for an appointment. You can also call the National Witness Project and the local number directly if you know that you sort of need some help navigating the process.
Great. Thank you so much.